Hello, everyone. I'm Archana Shekhara. I'm the founder and chair of Sadea, and you're joining Design Charcha this morning. And if it's afternoon for you, then good afternoon. Otherwise, good morning to everyone. So, what is Design Charcha? Design Charcha is an insightful dialogue series featuring creative professionals whose research and collaborations transverse within and beyond the South Asian diasporic context and perspectives. I'm so glad that we have Professor Ting Zhou joining us. And Ting is an assistant professor of web and interactive media design at the University of Connecticut, where her research focuses on UI UX design in healthcare, STEM education technology, design thinking, and design for social justice and human rights. Driven by a strong passion for human-centered and participatory design methodologies, she has collaborated with faculty across diverse disciplines, from nursing to chemistry, to develop websites, mobile health applications, and VR games that support research projects while promoting health and learning equity, particularly for underserved communities. So we welcome you, Ting, and thank you so much. We're really grateful that you're giving your time for us. So please take it away.
Thank you so much for having me. Can you see my screen? Is everything okay?
Yes, Ting, thank you.
Okay, thanks. Hello, everyone. My name is Ting Zhou. Currently, I'm assistant professor at University of Connecticut. And it's my honor to join the Design CHARCHA and give a presentation titled Designing with Purpose, Advancing Health and Wellbeing. So I'm a UI UX designer specializing in using human-centered design and design thinking, collaborating with diverse stakeholders to co-design digital health solutions and also products. So my current work explores using AI and machine learning as a design materials, not design tools, to create adaptive user interfaces. Why are choosing working for design for healthcare? Let's see. This is the information I got from our NIH website. The biggest health challenges in the United States. So you can see, thanks for the decades of research, Americans are living much longer now, but chronic disease still affects a large swaths of the population and evenly distributed creating health disparities. So those chronic illnesses are common and costly, and many are preventable. So NIH researchers basically translation and clinical and community based are tackling these challenges head on. At the same time, we see besides the physical health, and another side will have a challenge in healthy mind. So still from NIH website, we can see this is the four big challenges for healthy mind. So Alzheimer's disease, and traumatic brain injury, and the Parkinson's disease. And the last one will be the mental health. So we see only a few centuries ago, it seemed people physical organ, those things can control activities such as thinking and feeling. But now this amazing biological machine made up of rough 86 billion neurons and trillions of nerve circuits is command a center for many of the body's vital processes. So then how to keep people's mental and physical health is challenging. At the same time, we could see some new information about a cell phone. We can see almost 98% Americans own a mobile phone. And then for young kids, every day for people, Americans usually we spend 1.5 hours on our mobile phone and check the phone number 144 times per day. And then we see 57% of Americans consider themselves mobile phone addicted, and children usually get their phone as 11.6-year-old. My daughter is asking to get an Apple Watch this summer. But by age 15, almost all children have a cell phone. So we can see like over half the world internet traffic comes from mobile phones. So that give people like lots of access. You see, using the phone, if we can like using the phone to get the healthcare like support. So then we jump to see the like WTO's global strategy on digital health from 2020 to 2025. They specifically point out like digital technologies shaping the future of like global health. So they point out like in 2030 agenda for sustainable development highlights that the spread of information and communications technology and global interconnectedness had like great potential to accelerate human progress and also to bridge the digital divide and to develop like knowledge societies. So then we get kind of this opportunity to see potential. Digital healthcare offers a huge range of possibilities and may improve the quality of a patient's care. So that's the reason I choosing this as my research like focus for like I think 5 years already. We can see like this is a day like an image point out based in AI. Like now we're using lots of AI tools, AI and machine learning. So then when we're talking about how we can like incorporate this in like design more like accessible, inclusive design for like digital health products, we can see like using the medical sensors, activity like trackers, and also wearables, health questionnaires. We got the like data. So then we're using that data to like help people to think about to do the health monitoring, monitor your lifestyle, daily like activities, then generate the improved medical diagnosis and treatment. Like we're using the Apple Watch every day. Then you have the option to choose, do you want to share this like information with your primary like a doctor or even like a specific like doctors in like my chart. So it can improve like a patient's like a self like a monitor. And at the same time, we got these recommendations from WHO, point out like involve like stakeholders in program like design and implementation. So that's I call like a co-design and access efficient integration of programs within the health care system. So now you see, especially in my charts, you can get much more like healthcare information that help you to like monitor your like data, and also see at the same time when we're talking about data, especially I feel like thinking about the privacy, how to secure data confidentially, and also to obtain like informed consent is very important, and also ensure healthcare like workers have adequate like training, supervision, support, and incentives. They know how to use this like digital health products, and they are willing to use it, and also even want to like advocate and ask patients to use it, and also ensure like access to network connectivity and also electricity, ensure healthcare workers have access to functioning like a digital device. This is what I have been doing for years to doing like design for healthcare. So what I focus on doing like mHealth intervention design, especially focusing on like adaptive interface design because I was a trained graphic designer. And then what I do this, how can I do this? I using the interdisciplinary like collaboration. All of my projects, I don't work on my own, so I find like healthcare researchers to work together. And what's the like design approaches I use? So I use like a human-centered design, and human-centered design has always have like six kinds like approaches. Co-design is one of them, and because in the United States, design thinking is more popular than like Europe's like I think it's called a double diamond. I think it's a little bit similar like design thinking, but I'm more feel comfortable to use design thinking 5 steps as my like main design like approaches to work on this. At the same time, I'm exploring to like incorporate more like emerging technology and also machine learning to working on my like research. So here has some like a case studies based on my like research project. So first one is called Zuri. Zuri is like a M-health application, supports like a sexual self-efficacy among like Black adolescent girls. So I collaborated with Dr. Christina Ross. She's assistant professor of nursing at UConn. This project we have been working from 2022. I think the first year when I was on like I'm on tenure track position. So luckily we got the funding from UConn called the STEAM like grants. So that grants really helped us to like create the whole like prototype and do the usability test. And now she got the like external granting from Betty Irene Maureen Fellowship Program from UC Davis. So that's why we'll continually support her like a usability test. So Zuri, you see the name, is like we try to build like a big sister to like help and lead like those girls who live in foster care to learn how to do like support them do like a sexual self efficacy. So we because in like especially in foster care, they have a such huge like shortage. They don't get enough information access and also reliable information about like SRH, sexual and reproductive like health information. Most information they got from their like online, and because they live in foster care, they don't have feel comfortable to talk with foster care parents, so then gets much more trouble. Then they have more like a possibility to get certain like infection and also like a unwanted like pregnancy. So when we're working on this, we talked with Dr. Christina Ross, and we decided from the design parts, we feel make sure the design is fits their needs, and they especially feel okay. This is designed especially for ours. So from the logo, from the color palette, we try to like keep their like hairstyle and a smiling face, and inspired by their like culture, reflecting a traditional and vibrant like common see in African like design. So when we go to design like different features, we've decided to make them to choosing different like avatar, and also make them to like choosing whether you want to like track the information or you don't want, because currently in Connecticut it's fine. Like you can share, like a peer read those information, but for certain like states, it will be like give like those users much more challenge to track those health information. So the main features as like play with Zuri, learn with Zuri, track your health, and also chat with Zuri. So play with Zuri is like using the gamification to like design the several games, let them to learn how to like communicate with their partners. And the learn with Zuri has like using the animation to teach them, and also track the information is they can make a decision to how track what kind of information they healthcare information they want to like share later. And also chat with Zuri is when they have certain like emergency problem or something, they can like directly using this chat box and generated chat box to talk with Zuri. So we incorporate besides the interface, and then we also working with the sound design, character design, and also illustration design. Here is like a small loading animation. We can take a look. So here, like I mentioned, we're using the animation for like a teaching material. This small like animation is we created for teach them how to like do first time to see the like OBGYN doctor.
Hi, my name is Zuri. I'm going to talk to you about OBGYNs or obstetrician gynecologists and what to expect at your first visit with these doctors. So what is an OBGYN? An obstetrician gynecologist or OBGYN is a healthcare professional or doctor that specializes in female reproductive health. Doctors trained as OBGYNs specialize in both obstetrics and gynecology.
Sorry, this one is quite long, so I just like show some like glance to you. And you see from the like illustration and also the sound. The sound actually is from Dr. Ross. So we invited her to our like sound studio to make this like recording. And we have the 3 game design, teach them how to like do the negotiation challenge, how to like communicate with their like a partner, and using the right way to using the condom, and also like specific like situation, like how to say no, how to communicate with partner. So like we build for example this one is talking them like in different like scenarios, talking with like partners, teach them okay if they have this question point out and which one you can answer, and then what's kind of like a if doesn't work, and then what you can say. So help them, train them to like communicate efficiently with their partner. And here is like a short animation covers the whole like features of this like a mobile application. Thank you. So we bring this design back to the foster care and we did several rounds of like a usability test. So we got feedback from those like users. They are like girls who live in foster care and also foster care parents. So this is the feedback we got from them. And the overall, they are talking about the UI UX design parts. And from this project, I want to say is I learned so much, and I learned because it's my first collaborative project. I really understand being like a designer for like this kind of healthcare research projects. We needed to understand our role, because for certain design, for certain projects, they wouldn't think like a design is a research. They treat it as like a service. So for ours, how can you find your own role, and also think about how can we using our design be part of the a design research? Because not many collaborators can really understand how much time and how much energy are we needed to spend to create those design. So this is one thing I learned so much. I remember another thing is one of my mentors told me, when you're as a junior researcher and also a tenure track faculty, I mean junior faculty, you always need to have a courage. If you don't meet with a really responsible and also reliable collaborators, you always need to have a courage to say no and turn to another side, working on some other projects. Because trust yourself, if you have that ability, you can find a much better collaborators. So that's one thing I want to share with anyone like me as a junior faculty. This is my second project. I'm very excited for this one, because I think I also done my design side, and the developers is working with our team. And this fall, I think just so in 1 month, the website will be alive. So this one is funded by American Diabetics Association, and I collaborated Professor Yuqing Zhang, and she's a assistant professor of nursing at University of Cincinnati. So like I mentioned at the beginning, you see diabetics is one of the biggest challenge for America. So this one is we specially designed for diabetics patients to learn how to do self oral care. So for this design, we using, because most of patients users will be aging populations. They may don't have feel comfortable to using a dynamic interface. They more prefer a static a digital book. So then the design we will see keep the left side as the same, and using the a very simple and big size text, but still using the animation and also certain interactive design for this part. So we follow make sure they finish each module, and then they can jump to the next one. This one, when people touch the certain parts, they can read, have the specific audio to explain those terms to them. Incorporates a lot of video and animation. And Places is a project I worked by myself. This one lead by myself, and this one is specifically using the emerging technology, because we want to encourage people who in the early stage of dementia to do more physical activities, and also practice how to remember their family members themselves. Because for dementia patients, when they're getting this is one, it's no any medication can secure. So the only way we can just do our best to slow down the process a little bit. So this one can incorporate the AR. So it can using the tablet and also phone to access it. So you sign up the information, and then you do the basic screening, find out what's the how long time you want to do the exercises. Can be from 10 minutes to 60 minutes, and also point out the pain points. So those parts you don't need to work on those you don't need to do any like activities where using those parts like muscle, and also choosing the activities they want to do and something they don't want to do. So give them this option, and then they even can like upload the picture to create the like own digital coach. Because for like dementia patients, it's the like they may always forget the like latest like information. They may remember what's happened in their 20s or 30s. So they have that option, even can create like the background in that the time they feel more comfortable to do like an exercise. So then based on the like a digital coach generated, and then they can like have that one to lead them to do like the whole like exercise. So this is the tablet version, and this is like a phone version. And you see the last one is they can upload their family's pictures to there, and then doing some like a puzzle match. So then they practice remember family members' name, and even have certain like parts to remember who themselves. So like I mentioned before, too often design is treated as a service rather than like a integral like part of the research process. But rather than arguing or competing, I think the best approach is to focus on our like design practice and be strong and also supportive like collaborators. So and also like really spend our time on like designing better like outcome studies. So as a, like a design educator and a mental health, I will call it, I teach UI UX design course while like leading students to design for mental health. I teach this course in Yukon, and this summer I also taught this course in my hometown, China. Gets very like interesting like outcome, because I see there's so many things similar and also something very different. So why choosing to work on this is still based on the data, because the Health Mind study I have been following for several years. So this is the latest one. They're talking about, you see 38 like percent of students reported symptoms of depression, and 34% said they experienced anxiety, and 13% said they experienced the eating disorder, and also have 13% said that they had a suicide ideation. So we can see this is a huge like challenge on like a college campuses. So as a design educators and also designer who really care like mental health, I keep asking myself, what can I contribute to them? Because I'm not like a therapist, but through this design course, I was thinking like maybe it's a way besides to teach them how to do UI UX design, and also through this way we are mutually teach each other and let them understand, okay, it's not in this classroom so many of us facing these challenges. It's okay to not be okay, and we yes need to like be open and to seek help if we need. So that's I have been doing for years. So we applying like a human-centered design in digital mental health interventions, where I follow the design thinking 5 steps and lead them to do the design research, and they work as a team to figure out how to find the innovative way to doing the design the healthcare health application, and then they using the classroom, I mean, to like find some like users who has who is suffering those challenges to do the usability test. I want to choosing 2 like sample students' work to show you. This first one is called the worry box. These students told me when she was young, her parents taught her, when you have something you really worry, feel anxiety, angry to like deal with certain thing, you can write down and then make an origami and put in the box. So when she was taking my class, she decided she wants to transfer this one as a digital version. So then she created this mobile application called the Worry Box. So you see, she creates different like origami, and each one you can choose in your own color, and also you can label it and write down what you're really worrying on it, and then keep it in that box. And after a certain time, if things get better, you can just like let them go. So we have this small like video can show. When I was working with students, I feel like to let them understand like we are not like create like a big like a tool to work on certain like mental health challenge. Let them understand that yes, we need to figure out innovative way. It's like a little bit like a challenging because they really think about okay, we needed to like have something, have so many like features to work on this. Then I told them, okay, guys, in the classroom, in these projects, we need to understand like the challenge firstly, and then the most important thing when you're working on this, besides like a fancy, beautiful like a user interface, you need to really focus on the innovative part. Finding the challenge, the strategy, like in solution people doesn't use before. So then you have your own like innovative part. So then we jump to another one. This one is my students made this spring for her like a senior project, and we also went to the like a conference together. So she decided to using the VR technology to doing the meditation because I show her one like a app a psychology therapist made it using the like a VR technology and incorporate some like a nature environment to do the leading meditation. So then we're using Bazy, for us. I mean, the design students, some students in my classroom has quite good like coding experience, some skills. Some students, they don't have it. So now I think thanks for like so many like design tools, even you don't have those coding experience, you still can create like emerging like emerging technology to use this one. So this one is using the like VR technology. So when people wear the VR headset, you will see the like like a virtual environment to have someone lead you to do the like meditation. So we can using this one to take a look. So you see, like using the VR headsets, you can choose in different scenarios to do the leading like a meditation. And besides teaching the undergraduate students, and here are 4 like graduate students I mentored. 4 of them already like graduated, so they're choosing to work on different like mobile applications related to like mental health and also like physical health to as their like thesis projects. My first student in Zhou, currently she works as a UI UX designer in California. That's her project using the like called a snack bar and help like diabetics patients to find like their healthy snacks. And Roya, currently, she's a PhD student at NYU, pursue PhD in design for healthcare. And she designed this app called Hello He. So this one especially to like improve the communication between like patients and the partner, reduce their like relationship conflicts. And Maria Fahadi, and she's currently, I think, a new faculty at New Mexico State University. So that's her thesis project using the like gamification and also this mobile application together to support like patients have mild like a cognitive like impairment patients. And Amara, she works on designing a website platform to like support South Asian community who has like a mental health challenge. That's one I highly like suggest recommend if you want to take a look. It's a really good one. Yeah. Now I want to talk some about like the future of like digital health. And the science fiction author William Gibson said, who coined the term cyberspace, said the future is already here. It's just not evenly like distributed. So he means that many of the tools that will transform our lives are already in place, but not widely available or fully like realized. I think at this moment, when we check our phone and see our Apple Watch, those like digital tools is already on our phone. So as a designer and a design educator, we just need to focus on creating useful service design. That's yesterday I saw, I think Don Norman said, don't call UI UX design anymore. They said because that part only focus on the user. When we're doing co-design, we have so many like stakeholders inside. Join this like a whole process. Service design maybe more like a at this moment kind of like can reflect this better. So anyway, I decided when this morning when I was working on this, I said, okay, I'm going to highlight the service design and the support clinicians, patients, caregivers, and any other like stakeholders. And this is like image I showed before, but I still want to like bring it to this one because recently I'm working on this topic. So the use of like artificial intelligence, I know for design we use a lot of like AI tools for design. But have you think about if we, besides as a tool, if we treat as like design materials, how can we like develop health apps in like can give them use a more personalized healthcare, preventing like disease, improving like treatment, and also remotely monitoring individuals with like a chronic disease and providing like a better healthcare diverse delivery, and also decreasing costs and time to diagnosis. Like we can see using the medical sensors, using the activity trackers, and the variables like Apple Watch, like our like iPhone, and then we through the healthcare questionnaires, and then we got that large data connected, and also have the health service like provider. So then we can give information and help them to like monitor health, lifestyle, daily activities. Then eventually we can improve medical diagnosis and treatment, and also improve patients like a self-monitoring. And like I mentioned, that currently I'm more interested in adaptive like a user interface. So we can see these parts have like a 4 parts: understand, summarize, predict, and generate. So I think like now we're using the ChatGPT 5, and I mean, we can see things from ChatGPT 2, 3 to 4, and now 5. It's a huge like difference between them. So then through this, we can see, I think this is the trend, and also the possibility, definitely possibility in the future, because can really help us to understand our like a targeted user, and then can analyze and categorizing data into the like foundations, UI components, and also design systems, and then can put in things in text for like a users like patterns, so their personal like preference, and even the layout preference, color, those things, and then can generate like a personalized website. So for designers, I think we needed to like really focus on creating like flexible systems instead of a fixed like layout, and also building like components that can be adapted in different like devices, and also setting rules rather than expect like expectations. And then we do the tests for various scenarios instead of like one fixed design. Thank you so much. That's my presentation. Thank you.